So what does a laser light show have to do with healthcare? I'll explain how laser light technology is used to treat many common musculoskeletal conditions. Did you know laser light can help with osteoarthritis? Or after surgery for an ACL tear? Or even foot pain? This mouse symbolizes the first beneficiaries of cold laser therapy. In the late 60s, less than a decade after the laser light was invented, the Hungarian surgeon and research scientist Endre Mester was experimenting with mice and accidentally discovered that low-powered lasers had significant healing effects on several skin conditions. Maybe we shouldn't be entirely surprised. We know that sunlight is one of the primary givers of life. It delivers energy to simple cellular organisms. It makes plants grow. And most of us are familiar with our need for sunlight to produce vitamin D. Of course, it would be nice if we could get all the light we need from sunshine. But we hardly ever do, especially living around Vancouver. We also know that too much light, especially in certain wavelengths, is trouble. Too much ultraviolet light from the sun can cause sunburn or worse. Ideally, we'd like to get light at very specific colors or wavelengths, avoiding dangerous wavelengths like UVA and UVB, and all of the other wavelengths of light, which generate heat but otherwise don't help much. Since laser light can be created at very specific colors or wavelengths, it can do some jobs better than sunlight. LEDs were a second 1960s invention. LEDs are a much lower power light technology. But similar to laser, they can create light at rather specific wavelengths, which is exactly what we want. Armed with a good Hungarian doctor's discovery and lots of laser and LED lights, medical researchers found many applications, and they created a little problem. Way too many complicated names for the same thing. Low-intensity laser therapy, low-level laser therapy, cold laser therapy, soft laser therapy, and my personal favorite, near-infrared irradiation photobiomodulation. At our clinic, we call it cold laser therapy, simply because it seems the easiest to remember. If you Google the term cold laser therapy, you'll find lots of material. But how does it work? You may remember from biology class that our cells contain mitochondria, also known as the powerhouse of the cell. These are kind of like little tiny power plants which produce ATP, providing cellular energy. But injured cells generally don't produce enough ATP to heal optimally. But when exposed to light energy in the right wavelengths, the injured cells are stimulated to produce ATP back to healthy levels. This in turn enables the cells to perform their normal self-repairs much better than otherwise possible. In our clinic, we're using laser and LED lights to take advantage of their respective strengths. The red LED light covers a relatively large area and treats tissues closer to the surface. The infrared LED reaches deeper, and the infrared laser is a more concentrated beam and reaches the deepest. We're using 3 devices from the BioFlex system, which is made by a Canadian-based company. The first is a flexible pad with 180 red LED lights at a wavelength of 660 nanometers. The second uses near-infrared LEDs at 840 nanometers. The third is a laser wand producing near-infrared laser light at 830 nanometers. We treat many body parts. For example, we treat a lot of clients with knee pain from a variety of conditions, including osteoarthritis, internal scar tissue, tendinitis, post-ACL surgery, meniscus tears, and other knee injuries. Step 1 of a typical knee treatment uses the red LED pad. This light treats the tissues closer to the skin surface. This step typically includes 3 placements to surround the knee joint. Step 2 looks kind of the same, but the LED light is not visible since it's in the near-infrared spectrum. This infrared light reaches a little bit deeper than the red light from the prior step. This step also includes 3 placements to surround the knee joint. In step 3, we use a laser wand with near-infrared light at 830 nanometers. This light can reach the relatively deepest cells, right down to the surface of the bone. This laser wand emits very concentrated light, so we move it around on the area to be treated. The number of treatment sessions required varies depending on the condition and its severity. Simple conditions can resolve in as quickly as 5 treatment sessions. Really chronic and complicated conditions can take 30 or more treatment sessions. Treatment sessions typically last between 30 and 60 minutes depending on the body part being treated. And some of the best things about cold laser therapy: it is painless and non-toxic, non-invasive, and it will not interact with medications. In our practice treating musculoskeletal conditions, we apply cold laser therapy to achieve 2 main outcomes. Make pain go away. Most of our clients stop taking painkillers for the conditions we've treated with cold laser therapy. And restoring back to normal range of motion and mobility. There are never any guarantees with healthcare solutions, but in our experience, more than 80% of completed cold laser treatment series end up successful, so it's definitely worth checking out. Thank you.